Hi, everybody. This is Brittany Steffey. I'm the Food Access Program Director at Community Farm Alliance. So I run the Kentucky Double Dollars program, which is our statewide nutrition incentive program, which I'll be telling you a little bit about today. Sorry, my slides are being a little slow. Our program's mission is a little multifaceted. We're Community Farm Alliance, so we primarily provide support and advocacy to Kentucky farmers. So a major goal of the program is to increase sales and income for local Kentucky farmers. But of course, we're also a public health program, so we want to increase access to local food for low-income populations. And we really want to leverage a lot of the federal food and nutrition program funds coming into the state. There's a lot of that money coming into Kentucky. We want to see as much of it stay here and go to our local farmers as possible. So a lot of you are pretty familiar with these statistics, but just to highlight them, the landscape in Kentucky, about 17% of the population lives below the poverty line. This is a little bit of an old statistic. Of course, this will have changed as of 2020, as the crisis has kind of shifted things quite a bit. 15% of Kentuckians participate in SNAP. I haven't been able to get a new number for that, particularly since SNAP is kind of a transient program. Folks go on and off the rolls. And again, it's responsive to a major crisis. So 2020 changed the system a little bit. About 12.9% of adults in Kentucky have been diagnosed with diabetes, which can often be diet related. And an average adult in Kentucky, according to survey results, consumes about 1.9 servings of vegetables and 1.2 servings of fruit per day. So that's kind of the system that we're looking at, and what we're hoping to change and improve health outcomes for a little bit. So our program is a nutrition incentive program, and there are a lot of these kind of all over the country. At their basis, they're pretty simplified. So basically, folks have some sort of federal nutrition benefits. They spend those and get some sort of matching dollars for them that can be spent on fresh fruits and vegetables. There are lots of ways that that can look, and our program is a little complicated. So we actually have 4 incentive programs in one, essentially. We have matching programs for the Farmers Market Nutrition Program vouchers that are offered by the WIC program and the Kentucky Department of Agriculture. So these are offered to WIC participants as well as low-income seniors who are considered medically vulnerable. And folks receiving these get paper vouchers from the state that they can spend at their local farmers market on Kentucky grown fruits and vegetables. And we provide funding to farmers markets to allow them to provide matching vouchers so that customers spending those vouchers can get up to 2 bonus vouchers per day, essentially doubling the amount of fresh fruits and vegetables they can purchase with their vouchers at the market. Then we also offer a SNAP matching program. So customers using SNAP at a number of farmers markets across the site and a handful of retail sites as well. For every $10 to $12, depending on the site that they spend, will get matching tokens or vouchers that they can spend on Kentucky grown fruits and vegetables. At farmers markets, that looks like they run their EBT card. They get the tokens that they paid for with EBT that they can spend on anything SNAP eligible. Then they'll get some of the green tokens that you can see on the screen as a bonus that they can spend on fruits and vegetables. At a retail site, that looks like they run their card for any transaction over $10 on SNAP, and they'll get their normal transaction as well as a $10 produce voucher that they can come back at a different date and spend on local fruits and vegetables. A lot of farmers markets wanted to add an additional dimension of nutrition and support some of their other farmers. So we added on a local protein program a few years ago. So this works in conjunction with our SNAP fruit and vegetable program. We don't want it to be kind of standalone just because we're trying to support nutrition holistically. So customers using SNAP at the farmers markets that participate in this program, and I'll talk about them here in a moment, When they use their SNAP card in a market, we'll match up to $20. So the first $12 in bonus tokens will be for fruits and vegetables in green tokens. And then the next up to $8 will be in the purple tokens that you can see for Kentucky produced meat, eggs, or dairy. And again, I know this can be sort of a convoluted system. We have excellent partners at all of our farmers markets and partner sites that are usually great at explaining this to customers, and we do produce materials. But as I said, we're running multiple programs at once, and it's not uncommon for folks to be participating in multiple programs at one time. So I'll concentrate just a moment on the retail program as well, since that's a little more accessible to a lot of folks. That's offered at Good Foods Co-op in Lexington, who's been with us for quite a few years and is a great partner. And then just this past year, we expanded to a chain of local IGA stores in Eastern Kentucky. We started with the Manchester IGA in Clay County, and then this coming year, we'll be expanding to 3 more stores in Salyersville, Martin, and I'm forgetting the last site. I believe we're still finalizing it. So those will all run on a similar model. Basically, customers spend $10 or any SNAP transaction over $10 and then get a matching voucher that they can then bring back for produce. That's what it looks like at Good Foods. IGA had a little bit more technology, so they are able to just print it on the receipt. So when customers spend it, they just automatically get it printed on their receipt, much like extra coupons you get at Kroger. So just to talk about how many sites are participating, this should say 2021. So we actually have 51 farmers markets participating across the state. So these are just traditional farmers markets, what you think of when you picture a farmers market. They all do vary in size, from small to really, really large. But so traditional farmers markets participating, of those, 37 are participating in the WIC Farmers Market Nutrition Program matching. 47 are participating in the Senior Farmers Market Nutrition Program matching. That's by and large our most popular program, partly because senior hunger is such a large issue in Kentucky, and partly because it's a lot easier to administer than SNAP can be. The WIC and Senior Farmers Market Nutrition Programs are paper-based programs. They're using paper vouchers. They don't require extra machinery for the market. So this can be kind of an easy starting point for farmers markets that want to address food insecurity in their communities. The SNAP fruit and vegetable matching program is offered at 24 farmers markets across the state. And of those, 18 are also offering SNAP meat, egg, and dairy incentives. We'll have 5 retail sites, which are those that I mentioned earlier. And then we'll also have 19 community market sites. So these vary a little bit, but they include the Fresh Stop markets in Louisville, as well as a few CSAs. So these are primarily neighborhood or community run share programs. So they're multi-farmer CSAs where folks can come together to purchase produce, often at wholesale prices from local farmers, to buy shares, and often at a sliding scale, so that folks can buy it using SNAP or at a lower price than they would normally be able to. I always like to include a couple of quotes from folks who have used the program, just because we can kind of lose sight of how things look on the ground. This is from Casey Heisel, who is a longtime Double Dollars customer at the Lexington Farmers Market. The Double Dollars program is one of a kind and a saving grace for my family. It helps me stretch my monthly SNAP benefits longer, while also providing my family with fresh local produce, meat, and dairy. In the early spring, farmers will sell their seedlings, and this summer I used Double Dollars to plant a community garden at Flourish. I have and will continue to inform other SNAP recipients about this program in the hopes that others will participate and help the program to grow. That also highlights one really great part. We are allowed to use nutrition incentives for plants and seeds. So just as folks can use SNAP to purchase plants and seeds and those sorts of garden supplies. We can use our incentives for those as well, for plant starts and seeds. One more from Brittany Fields in Perry County. The market is like a taste of heaven for me. It brings back all the memories of being raised by my great-grandparents. They raised a big garden every year. I live at the old home place, but I don't have time to garden, so the market brings back all of those childhood memories. A lot of this is also just about kind of getting people out and engaging with their communities again and engaging with their farmers again, since that can kind of often create sort of a long-term change in folks' habits, especially around what they're eating. And I'll also include a plug for our newest program. So Kentucky Double Dollars is funded by a series of grants, both through the state and some private funders, and a large-scale federal FINI grant from the USDA. Just last year, we also got a large GUSNIP grant from the USDA. That's the Gus Schumacher Nutrition Incentive Program, to start a produce prescription program in Kentucky. So this is based off a model begun by the Community Farmers Market, which is located in Bowling Green, who had a very successful produce prescription program for expectant mothers who were low income. So we're expanding that hopefully to a number of sites across the state. This year we started with Lexington. So the model for the program is that expectant mothers who are enrolled in Medicaid can sign up for a 21 or 40-week produce prescription, where they get $20 in tokens every week for fresh fruits and vegetables, as well as ongoing consultation and nutrition education with a registered dietitian at the market who checks in with them each week as well. 2020, of course, as everyone knows, was an unusual year and not an ideal year to launch a new program. So we didn't have as high of participation as we wanted, partly because not as many folks were being referred for new programs. Community Farmers Market continued to participate. Lexington Farmers Market was our new site, but started as a pilot with very few participants. This coming year, we're hoping to expand to the Franklin County Farmers Market as well as the Perry County Farmers Market in addition to those two sites. And we'll have 1 year left on the grant after that, where we'll add 1 or 2 new markets as well. And I think that's everything I've got for today. So I think we'll switch over to questions, if that's all right, Ellen.
Great, thank you so much, Brittany. That was really interesting. And we have some questions popping up in the chat. So if you haven't entered your question yet, please feel free to do so by going into the question box and entering it there. The first question, I think, was just a clarification question. And they said, is the retail program being expanded to Martin, Kentucky or Martin County, Kentucky?
Martin, Kentucky.
Martin, okay, thank you. So now we'll get into some others. So one was,
sure.
If a community were interested in participating, what would they do to get started?
Yeah, so for the Double Dollars program itself, we open up our site application every year. So all of our markets actually have to reapply every year. Everyone reapplies for funding. Funding, unfortunately, isn't guaranteed because we're relying on so many funding partners every year and have to resubmit our budgets. So we open up an application for farmers market sites, usually in November or December. That might move a little earlier this year because of our grant cycle. And farmers markets complete that application and then usually hear back from us in the early spring. Beyond that, usually it does require a certain amount of capacity for the market before they can apply. So you know, farmers markets don't have to have like paid managers or anything, but if they're going to request funding for, say, the farmers market nutrition programs for WIC seniors, they do need to be registered with the state to already accept those and have farmers who can already accept those. Unfortunately, since we are a matching program, we do rely on the market already having the capacity to participate in those programs. We can provide some technical support to help folks get enrolled in those. We can provide some support for markets that want to start accepting SNAP but can't yet. But generally, to start getting funding, markets need to be at the point of already participating in those programs. But we'll release our application in the fall usually.
Okay, great, thank you. We have two similar questions about funding. So the first one says, what types of funding go into supporting and setting up these programs? The other asks specifically about expenses, startup expenses for farmers markets when they start any of the Double Dollars programs.
Yeah, so funding that goes into supporting this at the program level, as I said, Double Dollars itself is supported largely by a FINI program grant, which is a Food and Security Nutrition Incentive grant at the USDA. We're in our last year of that grant, so we'll be reapplying this year. It's a 4-year grant cycle. And of course, federal grants are lengthy applications and always a little complicated. It's a big bureaucracy. So that supports our SNAP program. Our other programs are supported primarily by the Kentucky Ag Development Fund, which is formerly operated through the Governor's Office of Ag Policy, soon to be moved to the Department of Ag via a new legislative bill, I believe. We get a lot of grant funding from the Kentucky Ag Development Fund from master tobacco settlement funding is what it primarily is. And then we get some private funding, mostly from MCOs like Passport and WellCare I have on screen, and some other private foundations. We're able to get a bit of funding. Since the program directly impacts so many different populations of communities at high health risk, as well as farmers and producers, we tend to have a lot of community buy-in and organizations supporting us. But of course, it's always hard to get funding for programs. So we have a lot of supporters, but we're kind of always working to get more for our programming. And the other question was about the startup cost for a market. Is that right?
Yes, like if a farmer's market wanted to get involved, what would their startup costs be?
Yeah, so on the market side, of course, there are any costs associated with operating the programs themselves. So administering these programs or administering grants always requires a little bit of admin work. So that needs either some really committed volunteers who are willing to be consistent or a paid manager. It kind of depends on the market and their capacity. Some counties have extension work with their markets and are able to divert some extension staff time to that, and that's always great too, because that staffing is already there. And then of course, things like operating an EBT machine and applying for an FNS authorization, which is what you need to become a SNAP retailer as a farmer's market. Doesn't necessarily cost money, but does take quite a bit of time and commitment. For our program, we don't have any sort of application fee or anything like that, but we do require cost share from farmers markets that participate. And that's 25% of the incentive cost. So the way that that actually looks is that our program is reimbursement based on a monthly basis during the season. So we basically will just reimburse 75% of the incentives redeemed at the market to each market. Most markets find local donors to cover that. Foundation for Appalachian Kentucky is a major donor for a lot of the markets in Appalachian counties, as well as a lot of other local hospitals, banks, community foundations, smaller donors in a lot of communities. Most markets are able to kind of outsource that to local donors.
That's really great and is a testament to the way communities really see the value in this and can have those partnerships that make all the difference. So glad to hear.
Absolutely.
We've heard a little bit from you about the Department of Ag and the grant funding that they give you and the help they give. Do they help you promote the Double Dollars program? Do they have a listing of all the locations where the program is available? What do they have any other kind of support other than financial for you?
Yeah, so we and just to clarify, they have not provided financial support previously. Our funding is from the Ag Development Board, which is under the Governor's Office of Ag Policy, but a recent legislative bill that just passed this session, I believe, will dissolve that office and move it to the Department of Ag.
Yeah, you're right.
So that gets complicated. But But they provide an immense amount of support, particularly just because of how heavily this program impacts Kentucky farmers and farmers markets, who they work very closely with. So yes, usually once we release all of our materials and our listings of markets for the season, they share those out widely. I don't know that they share them openly on their websites, but they do usually release them. When they publish their manual for farmers market operations every year, they put our information in there so that markets know who to contact. They're not a public health agency, so they generally are not in as close of contact with the populations using the programs or populations who need food security programs or food access programs. So they don't do as much outreach for us as other agencies do, but they help a great deal on the farmers market side, and do a lot of that support and work for us.
Okay, thank you. And thank you for clarifying. You're right that that office, Senate Bill 3 is moving that office, and but it's good that you already have that relationship and support with the Department of Ag, and that they've been a partner to you and of course to the farmers. So, thank you.
Oh yeah, absolutely. And they're extremely supportive of our programs and very helpful.
The next question that we have is about that Fresh RX program that you mentioned, Fresh RX for Moms. Do they partner with WIC in any way, or are there any partners that we should or could know about in that respect?
Yeah, so they're primarily, they're referral based, so they're partnering primarily with local clinics and healthcare providers. One of the stipulations of our federal grant is that everyone is referred directly by a healthcare provider. So I believe both of the current sites were partnering with their local WIC offices at the health departments for referrals. I think this past year, they weren't able to get very many referrals from those sites, partly because so many local health departments had to switch over to focusing really heavily on COVID efforts, and weren't doing as many in-person visits for WIC or any in-person visits for WIC in some cases. But they've certainly been in touch with them and are hoping this year to maybe transition to getting a lot more referrals from those sites. Otherwise, they partner with some local federally qualified healthcare centers, the midwife clinic at UK that's for high-risk medical cases specifically, and a couple other low-income care providers as well.
Great, thank you. It has definitely been an interesting year, and we know our local systems have been very heavily taxed, as have the state systems. And when I say taxed, just have an enormous workload trying to figure out the pandemic. So we appreciate all of that. We have a follow-up question about that Fresh RX program. Someone asked when they will be operational in Franklin and Perry counties.
Yeah, so we are launching that this year. Our plan is to launch at the beginning of May. I know last I spoke to Perry County, which was about a week ago, they're not sure when their market will be opening, or if their season might be a little delayed since so many of their farmers experience flooding. So we may be delaying our launch date there a little bit, just because nature impacts farmers sometimes, and can change things a little. So at least Franklin County hopes to launch in early May, and Perry County may do the same, but maybe postpone until June.
Okay, thank you. We are coming up on our last couple of minutes. I did want to ask about some of the other resources that you all offer, and some of those maybe are related to COVID. I know that you have the Central Appalachian Family Farm Fund, the new Kentucky Black Farmer Fund, and then just a lot of great best practices and guides for all kinds of farmers markets. Is there any of that you'd like to touch on, or any parting thoughts you'd like to leave us with?
Yeah, so we have a great farmers market support program, and that's the focus of that has shifted a little over the years, but we still provide a lot of technical support to farmers markets, as well as a market manager cost share for markets that do really want to grow their capacity by trying to hire a paid market manager. And folks can apply for that on the same application that they do double dollars. We kind of pair the funding a lot of the time. And then we offer a lot of technical support. When COVID started last year, we published kind of a best practices guide for markets. And then we provide a manual as well for a lot of markets that are getting started, and generally do a lot of policy and advocacy work at the state level as well for farmers and farmers markets. Most of that is on our website, and folks can also feel free to reach out to me at the contact info on the screen too.
Great. Well, thank you so much. Your website is cfaky.org. I visited that before. Again, this is Community Farm Alliance. We've been hearing from Brittany. She also told me before this started that they're developing some new materials. So normally we have some handouts in the handouts tab for you. And when those are ready, we will absolutely share those with everybody who attended today. Just didn't have them for you this morning. The other thing that we will be sharing with you is a recording of this. If you'd like to share it with anybody who wasn't able to make it, or if you would like to rewatch, we will have a link to that will go out. There have also been a couple of links shared in the chat. So I have shared the Google form where you all can give us your feedback on how this went and what we can do for future presentations. We're always looking for volunteers who would like to share a little bit about what they're doing to address physical activity, nutrition, or obesity in the state or out of the state. So let us know what you thought of this, share your ideas. And we hope that you will join us next month. We have these webinars the third Tuesday of each month. We try to run around 30 minutes. And so the next time we will be with Lisa Arvin, who is with the State Physical Activity and Nutrition Program, which is also where I work. My name is Ellen Cartmel. I guess I never mentioned that, sorry. I'm the mystery voice. But we'll be hearing from my colleague Lisa as she talks about the Kentucky Eating Disorder Council, which was established by legislation that passed last year. So we have one of the first eating disorder councils like this in the country. So really exciting, and she'll be talking about what that council does and how we can all get involved in their work. So the link to sign up for that or to register for that so that you are all ready to go on April 13th is in the chat box. I just shared it again. And we thank you all for joining. Feel free to reach out to Brittany at the contact information you see. Feel free to send any questions that you have to me at fitky@ky.gov. And we appreciate you all spending your morning with us. Thank you.